In 2020, an international audience witnessed the murder of George Floyd. This happened during a global pandemic that was already exposing racial healthcare inequities. This ignited a firestorm of diversity initiatives. However, good intentions don't always lead to successful outcomes. The authors present one institution's impactful program whose ultimate goal is to directly increase diverse candidates in the plastic surgery pipeline. The authors state mentorship is the single most important factor in advancing in plastic surgery, and longitudinal mentoring is much more impactful than a one-time meeting. But for students who are already underrepresented in plastic surgery, finding a mentor can be difficult. The author's goal was to create a program to help underrepresented groups be better prepared for interviews and elective rotations in plastic surgery. These groups include African Americans, Latinx, Native Americans, Pacific Islanders, LGBTQ, first-generation low-income students, and students without a home plastic surgery program. The year-long program, limited to 30 students, provided quarterly mentoring meetings and then an annual workshop that provided didactic lectures, a resident panel, social and networking events, cadaver dissections, and a suturing course. The program met all of its stated goals, and the participants ranked the program 9.4 out of 10. Students reported a significant increase in confidence in various aspects of plastic surgery knowledge and skills. Long-term follow-up will determine this program's ultimate impact on the plastic surgery pipeline. The authors provide a blueprint for a structured program aimed at increasing representation in plastic surgery. Understanding diversity includes knowing how diminished we all are when voices go unheard.